And Dr. Antony Wollaston, he is an attending ER physician at Blessing Hospital in Quincy, Illinois. Doctor, thank you for the time. I appreciate it.
Hello, Richard.
Well, obviously a lot of our focus, doctor, has been on cities, hospitals, particularly here in New York, and how overwhelmed they've been. But we know nothing is just going to stay in the epicenters of these cities. It's going to creep out. We've already started to see it in some of the suburbs, and we understand the rural communities. It's when, not if. To that end, I've heard a lot of concerns that the bandwidth for these hospitals to be able to handle that influx may not be there. You've got an interesting perspective because you've seen different parts of this country and the medical setups. Are those concerns legitimate?
I think where I am right now at Blessing Hospital in Quincy, Illinois, the situation actually looks fairly good. Our hospital staff here has done a good job of preparing. They've had a lot of lead time thanks to being about 3 to 4 weeks behind the New York epidemic. And so we've managed to increase our capacity fairly substantially as far as ventilators and staffing and extra beds and ICU beds and negative flow rooms. So I'm a lot more optimistic than I was a few weeks ago. I think they've done a rather good job.
To that end, is the expectation or almost the necessity that when some of these rural communities see the spike, and in certain states in this country, as many as 8 or 9 still don't even have mandatory quarantines here, when that day comes, are they going to need the help of the cities to start sending men and material, if you will, to supplement, or will the hospitals be able to handle some of the projected overflow?
I like what New York City and New York State have done. I think they've integrated the hospital systems throughout the state, and instead of operating independently, I think it's going to be important to try to coordinate a network approach across the state. And so to offload some of the busier hospitals to the downstate hospitals here in Illinois would be helpful, and then vice versa when the situation reverses, if it does, to be able to shift resources and materials around would be very helpful. So I think the New York system is going to be an interesting one to look at as far as how they're able to integrate their healthcare systems all as one unit.
You know, one of the things, doctor, is that I think people, and I understand why, they've been looking at this in terms of, okay, when's our peak going to be? When does the curve get flattened? But as we've seen with Asia and historically at every pandemic, there's not only one spike, there's going to be levels to this. And there's going to be probably repeat occurrences if history holds even as early as the fall. Hospitals, have been losing money hand over fist because every elective procedure has gone away, and they've had to furlough a whole bunch of doctors and also the support staff. I know we can only afford to look at the immediate time in front of us, but in terms of looking at this longer term and the ability for these hospitals to survive, let alone have the resources to deal with this pandemic, but also other medical needs for the community going forward. How worried are you that, yes, we might be in the beginning of April, but the problem doesn't go away magically in the next month or two? We're going to be dealing with this and other concerns here for a long time.
Yes, I think you mentioned the financial hit that a lot of hospitals have taken, especially the ones that have had time to prepare, because we started shutting down a lot of non-emergent elective type cases 2 to 3 weeks ago, and the income stream has been lost from that. A lot of physicians who rely on that income stream and the hospital that relies on that has suffered as a result. But I think the idea there was to try to prevent the peak of the curve from overtaking hospital capacity. I think once you've managed that, then you can start thinking about getting your hospital back to normal operations, in addition to maintaining vigilance as far as any recurrent outbreaks.
I wonder what the feeling there must be like, knowing that you're 3 weeks, 4 weeks away from being in the eye of this pandemic. Is there trepidation? Obviously, you're looking to other hospitals to see what their realities now are. What are the conversations I can only imagine like between your other colleagues, RNs, et cetera? I know you've already seen a doubling and tripling of patients over the last few weeks here, but the worst is to come. What is that feeling like?
Well, it's an unknown. I mean, none of us, I don't think, have lived through this. And so, like I said, we've had the advantage of at least seeing how New York has dealt with their onslaught. And I think we're more mentally prepared than they were, perhaps. But I think when it does happen and the hospital does start to look like it's getting overwhelmed, it will become rather frightening. I think staff are concerned about their own health and welfare, and there's that of their families. And so that's an underlying mental stress that they've got to deal with. And so this is completely different from anything we've dealt with in the past. And I think we're fairly well positioned at this point, but talk to me in a month and we'll see how it goes.
In terms of, some of the conversations I had never heard before, where you had today, the head of the CDC and a trade commissioner debating about, for example, a drug, hydroxychloroquine. And in terms of protocols and in terms of, the normal checks and balances before something like that were to be put out widely in the marketplace, what's your thoughts on this? And are you concerned at all that there isn't always clear direction about where we're going from a national perspective, given that we're dealing, this is in 50 states with 50 different approaches here. There should be some uniformity to it. A lot of times it doesn't seem that there is.
Yes, we would love to see more uniformity as far as protocols and with regards to treatment plans and best drug choices. We would like to see better outlines regarding PPE. And I think retrospectively, this should have been done prior to this, but hopefully we can learn from this and be more prepared for the next pandemic, which I'm sure will happen again in the future. I can't say when, but it's not something we can say this is a once in a lifetime event. This is certainly something that may recur within our lifetimes.
And finally, Doctor, on the subject of testing or the lack thereof, especially if we're going to try to figure out when is the right time, how many people have actually been exposed to this or not, or actually have been, have had positive, tests to it. There is no real database at this point, and there isn't an ease, at least with rapid testing, although the promise holds that there might be one in the future. Explain to everybody why it's really important that if we don't know nationally, and we don't have nationally testing for this, it's going to be hard to really be able to have a baseline as to what are we talking about in this population, how many people still have yet to be exposed.
Yeah, testing is a huge issue on a number of levels. I think from the emergency standpoint, we'd like to see a rapid test as quick as the flu test, and that allows us to quickly triage patients and to know who's potentially infectious and who isn't, and what floor is appropriate for them, et cetera. I can tailor our treatment almost immediately rather than waiting 2 to 3 days for a test result to come back. I think then on the population level, you have to know what percentage of your population is infected or what proportion of the population is infected and asymptomatic. That allows those people to potentially be productive members of society and continue allowing the economy to function. And then the serologic testing is important. At some point, we're going to have to get that going so we know who's been exposed to this virus and who's developed the immunity. And so then those people are going to be able to, once again, get back into the workforce and ultimately get the economy moving again. And those are important things. I think testing should have been first and foremost in everybody's mind when they first heard about this outbreak in China. And I think in the future, there should be some rapid testing protocol that's developed the moment anything like this is even thought of being a concern. There should be a team of scientists and experts who the first thing they do before anything else is probably work on some sort of rapid test to allow the screening, to allow the mitigation, and those types of protocols to be put into place.
Well, Dr. Wollaston, I wish you nothing but the best, and hopefully when, unfortunately, you deal with the surging cases, it sounds like you guys have gotten ahead of the curve, so let's hope that's the case. Thank you, Doctor.
Thank you.